So we have a 6-month-old baby girl who presented to us with lethargy, poor feeding. She has a temperature of over 38. She
When I think about the person on the other end of that phone, I think you want to hear right away that you have a 6-month-old in septic shock.
Exactly.
It just really kind of tunes you into that's what's going on, because I don't think you really need to take that long to kind of try to sort out what's going on the phone.
I agree. One way that I like is SBAR, so that situation, 6-month-old septic shock, and then the quick background story, lethargy, fever, etc. And then my assessment, so my vital signs, what I've done already, any labs, blood work, etc. that I've got, and then my recommendations around, please come, let's transport this baby. So just gives that person on the other line a really quick snapshot.
Yeah, it's very important to communicate very, very clearly.
Agreed.
Dopamine, and we've had to also place an intraosseous catheter. I'm concerned that at this point baby is now requiring dopamine for pressure support, and we've also started hydrocortisone. And I'd like to arrange transfer for baby to your center. And we have contemplated potentially intubating baby before transfer. All right, so let's get our airway equipment ready, guys. We'll aim to intubate baby before we transfer. We'll need to call our X-ray tech and just confirm tube placement before we send them off. But we'll aim to transfer baby within the next 30 minutes. Okay, thanks very much. Bye.
Certainly, if you're somewhere where you have to send a child and you're in a peripheral hospital, oftentimes we do need to secure the airway to be able to make it safer for that baby to fly. I think what's important is that we volume resuscitate them prior to intubation, because we certainly know that when we intubate children, they will definitely drop their blood pressure if they're not filled up. So making sure they're well volume resuscitated and also have dopamine in line before we intubate them is important. So I think they've done all the right steps prior to thinking about intubating. Intubation medication, what do you think, Gina, in this population?
So we know that, as you say, intubation is a very stressful event, and often that's actually when children are going to deteriorate is with the intubation. So I agree with you. It's really important to try to volume resuscitate them as much as possible before you go to intubate. So you really want to give medication that's going to avoid any hypotension.
Exactly.
So usually we would probably recommend something like ketamine, which is going to be the least likely to cause hypotension. But remembering that if a child is catecholamine depleted, even ketamine can cause hypotension.
For sure. I mean, certainly ketamine was recommended in the surviving sepsis guidelines for pediatrics, so I agree. I think ketamine is a great choice. Having atropine available for someone this age would definitely be important to have drawn up. And yeah, you know what, I always get a whole bunch of fluid boluses ready to go before I'm intubating someone. In addition, I often get a second inotrope ready to go too in case I'm really stuck in that situation. So we don't take intubation lightly in patients like this. At the same time, we need to make sure they have a secure airway prior to transport.
Yeah, and the choice of paralytic really can be either ocurrence or sexual choline. That's not as probably as important.
I agree.